Hello, my name is Toby. Welcome to the vlog. Why did I start like that? Because we're recording a second version when I've actually got my badge on. It's so important, isn't it, that we keep going with that campaign. Nonetheless, I am going to talk quickly because we've got a wonderful interview coming up with Dr. Ben Allen, our medical director in the Physical Health and Neurodiversity Care Group. So look out for that. And then at the end of the film, we'll have the dates for your diary for the open staff meetings that start in a few days' time, including an event in the Elizabeth Quarter, which obviously we're opening as one of our new bases in Scunthorpe during November. So look out for that, and please do get involved if you can. Just a couple of positive messages. Over the course this week, clearly we've had Diwali, and in the Trust we've had the first of our Diwali decorating contest, first annual Diwali decorating contest. Thank you to everybody who got involved. Congratulations to Lindsay and Balvinda and to Rebecca, who were respectively part of the With Me in Mind team who won a prize, and the Zone 5 to 19 service at the Flying Scotsman who won the top prize. But honestly, across a number of services, clinical and backbone, there were some fantastic displays. And most importantly, it was clear that teams that had real conversations about what the Festival of Lights means to them, the various religious traditions that come together in Diwali. So I'm sure culturally an important thing for us to do as an organisation that aims to be, but isn't yet fully inclusive. I'm a Crystal Palace fan, so league tables can come and they can go, but let's be a little bit proud. Right now, we are top of the entire NHS for our flu vaccination efforts. Congratulations to everybody involved, most particularly our flu vaccinators, to the team centrally, and to everybody who is working to make sure that we keep each other safe. It is a race. Herd coverage is really, really important. But I guess to me, what's most important is that you make your flu vaccination decision. You may choose not to have the vaccine. I hope you choose to have the vaccine. The worst of all possible worlds is to just kick the can down the road, not make a decision, drift into the winter, and then perhaps put yourself in harm's way. So it's fantastic that we are doing so well. We've got a long way to go. But if I can really encourage you before October is out to get your flu vaccine or record your decision the other way in the usual fashion. Thanks ever so much. Now, not all of Ben's interview, which we recorded earlier in the week, is about neighbourhoods. It does get a mention, and he's got some fantastic suggestions for us as well. Obviously, joined us as part of the Clinical Leadership Executive. So over to Ben for the interview that we did. Cheers. Ben, thanks ever so much for doing this, for the contribution you're making in physical health and elsewhere. Tell me, what as a GP, what matters most about what teams here at Ardash can do for your patients?
So I think the main thing is that we see most people day in, day out, and we can manage it. And sometimes we need the expertise of a specialist or people who got more kind of day-to-day access to being able to kind of have long-term care in people's homes. And sometimes we just that's what we need. And so that being the best it can is the best way to help primary care. And so that in one way may look like the kind of the traditional way of sending out a referral and saying we need your help, and then that being timely, I think, which you're clearly there's been doing a huge amount of work on. But I wonder whether or not there could be other ways of supporting, which may be more kind of, I've seen these kind of models in other countries where the primary care team maintains most of the contact, but is pulling in that expertise. So rather than necessarily the nurse going out to do the care, it might be having time with a nurse who can support you with, let's say, insulin management or something, having the expertise at the end of a line, being responsive in that way. That's another way of
Yes, and I've seen that work as well, but it is a very different way of practicing, isn't it? And we probably need to think together about how we support people to do that. A lot of the time at the moment in my working life, probably in yours as well, people talk to me about neighbourhood health, and it's at risk of being all things to all humans. But let's have the the Ben Allen version. What does it mean to you, and what would you say it means to
Yeah.
some of your primary care
No,
colleagues?
I think it really is quite complicated actually, or quite hard to pin down. The way that I tend to see it and explain it is that I think if someone's got one condition and it's become very complex and you need another team who's a specialist team, you can refer them or you can get their support. um, and now the problem is that more and more people are having more and more problems, and then you start having to involve more and more teams, and that whether that be specialist care or social care or education, and what you've and it doesn't follow that one team supporting somebody with one problem, you can times that by 5 or 6 and it works.
Sure.
That model starts to break down the more people are involved, and so what you end up with is often is different teams deeply involved with the same people independently doing their own assessments and we all want to help people, but we can only help them with the tools that we've got. So we sometimes use tools that we know are not really what this person needs, but it's we want to help them and it's what we can do. And I think that neighborhood health in my mind is looking at who are the people who have complex needs, who've got lots of services involved, getting those services together and saying, okay, how are we going to work together to approach looking after this individual and this individual and that individual, and hopefully coming up with something that's far more sensible, more patient centered, more clearly what that patient needs, and I think hopefully more resource. Actually using our resources better, because actually it does take resource to build relationships and trust, and that is really important. That takes time, and so that is important to say. But I think that the aim, and I think my hope is that overall it's a win, because actually often we can meet the needs of those individuals better as a team working together, and sometimes shouldering some of the care at different times and moving it around in that way.
Yeah, and I guess we talk about how we build multi-professional working, build those kind of relationships, not just for the most complex patients, but actually for people who may have multiple conditions. They may not be inherently complex. They're just, as you say, there's a lot going on.
Yeah.
That makes sense.
So yeah.
And the NHS is often tended to not work that way.
Yeah.
But here at Ardash, you've worked with us for a little while. So what do you see? What's enthusing you, and where do you see some of maybe our blind spots that when you think about?
So I have loved working here, and I could see what Ardash was vocalizing what it was attempting to do and the way it was trying to work things differently, and that was very attractive to me, and it attracted me to Ardash. And it's been wonderful to see that it's not just something that you are vocalizing. You can see that determination day to day to making change happen. So the kind of things that I feel that I also really care about, I think, is that giving power to the communities and the patient voice. So the way that you use care opinion, the way that you engage with people in that way, and the way that you involve the staff in care opinion, the way that you're trying to get patient voice into some of the governance structures, I think is brilliant. The transparency, I think your willingness to be honest about where you're struggling, because most trusts they care so much about reputation that when there's a problem they'd rather hide it, and I think there's a real bravery of being actually the way to get better is to be more honest, and I've seen that. And yeah, so I can see a huge amount of innovation in terms of kind of, and again, I'm hesitant to suggest this because I've only been here for a couple of months, but I see the innovation that you've done in the kind of bringing the patient voice in through care opinion, um, and I wonder whether or not there's some. No, there may have been something like this in the past, but what's the infrastructure to enable that staff engagement? Is it via kind of team leaders and newsletters and emails, or actually could there be something that is a space where people can share their questions, share their ideas, something that's really good's happening in one bit of the organization, they can share that story, but someone can ask them a question about it, and they may end up arranging a visit, or they might pull in an idea they've seen from another trust and share it. And I think that kind of engagement really draws people, and it becomes the reality is that the way that change happens often is it emerges through a complex web of interconnections, and you need an infrastructure for that to happen. And I've been surprised that there's not actually in lots of other trust. I think that infrastructure isn't there, and there may be good reasons that I've not learned it up.
No,
So that was probably the main thing that I spotted, but I'm only a couple of months in.
No, but also that is,
Yeah.
isn't that sort of participation is how you help to transform your own practice as a GP,
Yeah.
as I remember.
Yeah.
So in a sense, you're building on that
Yeah.
methodology you've seen work.
Yeah.
I'm sure there's space to bring some of that into our organisation.
Yeah, no, that is where I've seen it. And it almost feels like it's kind of almost like one hand tied behind your back, because I'm used to that being able to just kind of put out like a quick question or a poll about what should we do about this.
Yeah.
And then you see all the votes coming in, and it become, not only do you get a better answer,
Mm.
everyone is able to live with the answer because they can see, well, 70% of people, that's what they wanted.
Yeah.
And so that but very rapid process I find really helpful in my practice. But it's like, how do you make, but I've got 50 people there, and we've got like 5,000 that's a tier. So it doesn't necessarily mean that you can just move it across this.
But as I say, I think people are so enthused by our opinion. If we take that as a role model, I think there's real opportunity, and it's the SAF survey at the moment. So maybe something for people to hold on to. Thanks ever so much, Ben, for your thoughts. All the best.
All right.